Simon and Simon.
Oh, my. She has got a great body.
This is not gonna be easy.
You're a malingering fraud, and you're no more crippled than I am.
Fire! Oh, wait! Save yourself!
It's a gas fireplace, pal.
Every man for himself! Raise your right hand!
We're deputies.
Positive and supply staff.
I'm sorry, Dr. Stephanie. I'm in training. I don't belong.
Who's your supervisor?
Erin.
I know who she is. All right. You report to Nurse Erin. You tell her that I'm taking Dr. Tyler's patient into emergency surgery. Then you contact this girl's parents and you get them down here. You tell them their daughter is critical. Be frank, but don't shake them up. Now go, go, go. Look at the size of that clot. Damn, how could you let it go this long?
Cardiac arrest.
There's a cardiology resident in here. Heart needle. 1 milligram of adrenaline, 50 milligrams of sodium bicarbonate. Paddles, scope. Clear. Needle. Clear. Damn, crack her chest.
The cardiology resident is on his way.
We're not waiting. This girl is dying. Let's go.
Visiting hours will be ending in 15 minutes. All visitors, please leave the hospital at this time. Dr. Hoyt.
This is Mr. and Mrs. Bates, Doctor. This is Dr. Stepney.
Dr. Hoyt, please come to
Miss
reception.
Bates. Miss Bates. Your daughter has had a very tough couple of hours. Her heart failed once, but she's stable. She's stable now, and I'm confident that she's going to be fine. I'm sure you want to see her, and she's in recovery right down the hall.
Hey.
It's a back breaker. How long is this going to take?
Well, that depends on your decision.
It's the same. Richard's still sticking to his story. Hello, Mrs. Addison. How are you? Up and around, I see. Oh, my girl.
Dr. Pulaski needed an emergency.
You and me. We've got something to talk about.
Kyle, Richard.
We called your office. We called your club. You really should check in sometime, Dr. Tyler.
It's Thursday, Kyle. I was meeting with the Board of Governors. I haven't got time right now.
Well, you better make the time.
Hadn't you better worry about your own problems? I'd say a $6 million malpractice suit ought to give you some pause for thought.
Dr. Stevens needed an ICU. Dr. Stevens needed...
You're a malingering fraud, and you're no more crippled than I am. And I'm not playing your game, boy. You want to sue me? Fine, sue me. I'll sue you in court where you'll have the chance to prove it.
right, Amon, there's a slight break to the left, so just, be ready for it.
Breaks to the left, but it's not slight. It's major.
All right, now look, Mom. Took you 9 strokes to get here, so nail this thing, okay? Slight break.
Major break.
Slight.
The reason I'm down in 9 is because you boys keep yakking while I'm trying to concentrate. Would you both please be quiet?
When's the tournament?
Next Saturday.
It's a shame they don't have lights out here. If you practice day and night, you might be able to...
Would you please? Oh, I hope this goes in, because if it does, I'll never let you forget it. Leave my clubs. Hi, Pat.
Buster?
Hi, boys. Where have you been?
Trying to avoid this moment. Hi, Pat. And the answer is no. We have sworn off medical malpractice.
Since when?
Since the last time we worked for you. Remember, we almost died on that one. 15 hours under that woman's...
I should have remembered. You guys have your standards.
Yes.
You draw the line at peeping into other people's bedrooms.
No, not actually. We don't. Well, look, even the worst divorce case doesn't make you sick. I mean, every time we do malpractice, I come down with something.
Oh, AJ, your imagination is working overtime.
I do.
Well, at least let Pat tell you what she wants.
Yeah. No one I trust as much when it comes to busting fakes. This is Dr. Kyle Stepney. He won't settle out of court, and they're asking $6 million.
Who's their lawyer?
Dorsey Pender.
Oh.
How's their case?
They botched a lumbar myelogram.
Is that dangerous?
Well, of course it is, if it isn't done properly. It's a standard procedure for injecting dye into the spinal canal. Nothing special.
The bottom line is Carl's insurance company wants him to settle. They don't want him to fight it and risk a $6 million excess verdict. And if he insists, they'll dump him.
Well, then why not settle? That's what insurance is for.
I think it's shameful. Remember I told you when you were 4 years old and you had that terrible tonsillitis?
Yeah, but wait, Mom.
And they gave you penicillin, which causes a severe allergic reaction?
I know,
The
Mom.
doctors worked day and night to save your life. And Kyle Stepney is that kind of a doctor. And those people want to take his money away. Not only that, what's worse, they're trying to ruin his reputation. How can you let that happen?
How do you go from lieutenant detective to traffic control in the space of a week?
Will you hold it down? Too bad you didn't bring a bullhorn. You could have blown my whole cover here.
That cold.
It's not a cold. It's these pepper trees.
Uh-huh.
What do you want?
We bought you some antihistamines.
Right. Look, I'll be back in the office about 4. See you then.
Hey, look, when you get back there, would you check and see if there's a make sheet on a guy named Richards, Vic Richards?
Later. Don't hassle me now,
Hey,
okay?
Pound. What are you doing?
Mistake.
Raise your right hand.
We're deputies.
Read this scum his rights and get him out of my face.
Vic Richards, a.k.a. Richard Vic, Robert Vinson, settled out of court. In 1981, he was expelled from Arizona Polytech for tampering while working part-time in the bursar's office.
Tampering with what?
The bursar's wife.
That doesn't prove anything. You better get him up out of the wheelchair.
Well, I don't envy you guys. Those miracle cures are hard work.
Sounds like a job for Klazuski.
Who? Dorsey Pender is Richard's lawyer. 5 will get you 10. This is a scam.
Man's elevated ambulance chasing you an art.
Are you kidding? Sound of a siren would get him up off his deathbed, and when he laid back down, he'd be a whole lot richer, too. Tell me something.
Yeah.
This Sheila Kazuski has such a great body. How come you never mentioned her before?
Because she's got such a great body.
Ah, boy.
Wait till you see this.
Has got a great red eye lie. That girl, Sheila. Oh, nice move. Nice move. Lazarus would rise from the dead.
Oh, come on, Sheila. You can take her. You can take her. No. Don't.
Trying to get her tire fixed.
Die Schlampe kann es so fahren.
Must be the physical therapist Pat was talking about.
Yeah, Valkyrie yourself, right?
What do you do?
No, Sheila.
Worse. Now, you could be really paralyzed.
Who's that? Yeah, this kind of reminds me of that mob staging accidents out on the I-15.
Oh, come on.
Never would have nailed them if that guy hadn't crossed the center divider and caught him northbound Peterbilt.
Oh, come on. Don't remind me. I can still see the picture you took.
I was kind of proud of that one. Won an honorable mention at the surveillance photo contest.
It's far enough. Far enough. Yes, far.
Hey, did he? He was on his way. He was gonna.
Okay, Ava. You get the beer. Schnell.
Well, he didn't. Come on.
Boy, this rim's been real bad.
You're gonna have a new wheel.
How much is that gonna cost?
I don't know. I'll check.
Hey, look here.
Yeah, you're gonna pay all.
Oh, Sheila, you know better than to drive on a flat tire.
What was I supposed to do? That bimbo threatened in German to break both my
I
arms.
didn't know you spoke German.
I don't.
Then how do you know what she was talking about?
By the look in her eyes.
Hey, wait a minute.
Now how do we get the guy out of the chair?
I don't know. Call Earl Roberts.
Bleib sitzen. Komm, mein Liebchen.
Swell. It was Carlos's favorite snake.
Maybe you can get it back.
AJ the snake just got out rattled by the Rhine maiden over there. One thing worse than a scared rattler is an embarrassed rattler.
What a day. Scrapbook of misguided memories. Well, Eva clearly looks more poisonous than the snake does. I suppose a rattler loses its confidence when it's been defanged.
Wouldn't you? Well, I thought the itching powder would do the trick.
No, look at this. Didn't even jump when the hand grenade went off. Tell you, we've tried everything. Lust, fear, greed.
By now we could have freaked out even
Nothing's brought
Job.
this guy to his feet. I tell you, he's the best I've ever seen.
He's still a phony, though. We're just gonna have to wait him out. Round-the-clock surveillance, 24 hours a day, then I'll do it.
Well, we keep this up, we're gonna get into the Guinness Book of World Records for the longest stakeout in history. Come to?
Yeah?
Why don't I go over there and talk to them while you play Mr. Chimney?
No. I played Mr. Chimney the last time. It's your turn.
Oh, come on, Rick. You're good at it.
Forget it, AJ. I'm gonna go to the
look,
hospital.
come on. The
You're
reason
gonna
you
play
do
Mr.
it is it's
Chimney.
your strong suit.
Hey, look.
You've always enjoyed doing it. It's what you're
Just
good
remember,
at.
when you pull the pin, keep your hand on the
Oh,
spoon, because last time I used this thing, I was brushing my teeth with scouring powder for a week.
Don't do that. How you doing, Mr. Chimney?
Wir brauchen nichts. Gehen Sie fort.
Hey, it's no big deal to me. I got an industrial smokestack.
Come on in, come on in. I've never seen a chimney sweep. Besides, it could be the highlight of the day.
Mr. Simon, I don't have either the time or the inclination to discuss Dr. Stepney or any other member of my staff with you.
Oh, I understand you guys are all members of the same elite little club here.
Oh, I'm afraid I resent that. As chief of surgery, I have assembled a staff that is far from elite. And if Dr. Zana's here, especially when we have so much to do.
Well, tell me, you think it's possible that he did make a mistake during the surgery?
If you're asking for my personal opinion, I would say no. No, he's an excellent surgeon. But even excellent surgeons make serious mistakes, so yes, it is possible.
But he'd know if he were responsible.
Some men's egos are so big, they have trouble seeing over them. Excuse me.
Dr. Tyler, please report to administration. A resident is needed in pediatrics isolation ward immediately.
Calm down, Helen. There is nothing to worry about. It is routine for detectives to hang around hospitals asking questions. It just means Stepney's getting desperate. Hold on.
Fire! Fire! Oh, quick! Save yourself! Quick, before the house goes!
That's a gas fireplace, pal. The gas is shut off.
Every man for himself!
Helen, listen.
What?
Nothing.
What?
You want to do Swami for me?
I just got myself prepped for night work a little early, that's all.
I take it that means the mighty Mr. Chimney has struck out.
We will get him tonight.
Since we gotta have it back by noon tomorrow, I don't think the owner knows it's missing.
Oh, come on. Now, Rick, I told you the last time I didn't want Carlos to...
Hey, I think it's awfully nice, Carlos, considering what you did to his snake.
What do you mean what I did to his snake?
It's okay. I told him we'd use the scope to find some baby water moccasins here in the swamp tonight. They're poisonous.
How are we doing?
Still nothing.
I'm not gonna spend another night in the swamp.
Maybe the Hun just drove off. You think?
Well, what are you here for today? Clean out the drains?
Nah. Just thought we'd drop by and let you know we got some nice photographs of you.
Oh, yeah? What am I doing?
Oh, not much, just kind of.
How much you built the defendants for in those other malpractice scams?
What those doctors did to me, they got off easy. Now get out of here.
How long are you gonna stay in that wheelchair? I mean, it's gonna be about a year before your trial comes to court.
Oh, and don't try a disappearing act, because wherever you go, we're gonna be there.
Scumballs better make tracks before I call the cops.
No, I don't think they're gonna eat bones where you're going.
My legs are paralyzed. I can't even swim.
Good lines.
Yeah?
Mm-hmm.
No signs of thrashing around or anything?
No. Guy's good. Air bubbles, that's a nice touch.
Air bubbles?
Nobody's lungs are that good.
but kill me.
You okay?
Look, let's get you to the house. We'll dry you off and we'll talk about this, okay?
Right to the bottom. Report.
Yes, we had Richards examined by a second neurologist late yesterday, and they showed no nerve action between L3 and S1.
Oh, great.
Oh, that's nice.
Which is impossible. In order to cause that much paralysis, you'd have to use a huge needle, something larger than a 21. A first-year med student wouldn't make that kind of mistake.
Some other kind of mistake, then?
I didn't make a mistake. He's faking.
The man was drowning. It's kind of a low percentage way to rip off an insurance company. You do make mistakes, don't you? I mean, you are human.
Life stops. Do you understand me, mister? It stops right here in these hands with some regularity. Now, that is very humanizing. Yeah, I make mistakes. And then I suffer for it, and then I learn. I learn to never, ever make that mistake again. Because the margin for error in neurosurgery is 0. Now, I have done hundreds of myograms. I did not screw up Vic Richards' back, and I am not taking the blame for it. I've got to get to the hospital.
It is confidence talking, I hope. Not arrogance.
I've already told you, I'm not perfect. But I am a damn
doctor.
Up to you. Look, Pat. We're in awe of your tenacity. We're also off the case.
Oh.
Sorry. Hey, wait a minute. This is our office. You leave.
Never going to court. Are you listening? It's good.
2 detectives nosing around. No. So I am through. That's it.
Okay, you're through. For today.
No, I mean, it's over. You can leave town. I don't care what you do. Anything you have to call them off.
Nobody's going anywhere. Except you. And that's back to your office. We're in this game together, and we're gonna play it down to the end. And if I need another nerve block or anything else to make sure that we win, you're gonna do it.
Okay. I feel badly about leaving Pat hanging.
I feel even worse about almost drowning a paraplegic.
Hi! I couldn't sleep either. And then suddenly I had this thought. Spinal block. And the effects would have lasted until you guys threw him in the lake.
Okay. Now, assuming that you're right, Pender couldn't have given him the block, nor could Eva. I mean, it had to be another neurologist, right?
Well, if anyone knows where to buy a neurologist, it's Dorsey Pender.
How do we prove that?
Well, try this on for size. What happens to a man who marches to the beat of a different drum?
He gets out of step.
He also irritates most of his fellow marchers. I'll bet Stepney has irritated most of the surgical residents.
Could be. It's a start.
You know, my back has been hurting me lately. Think Stepney would admit me to the hospital as his patient?
Yeah.
Oh.
It hurts, huh?
Yeah.
In here?
Yes.
Mm-hmm. Okay. Very good. Oh, very good. Oh. Now, side to side.
That's okay. Oh, it hurts a little.
Okay, on your back now.
Oh, okay.
Don't worry. Okay, now I want you to keep your left leg straight. I'm going to raise it up.
Okay. How many neurosurgeons are there on staff here?
3. Dr. Tyler is the chief of staff, Stepney and Shigeta. Does that hurt?
No. And if I wanted to get a second opinion, who would you recommend?
Uh-oh. Smart, son.
Yeah.
What were you saying?
If I wanted a second opinion, who would you recommend?
Stepney's the finest neurosurgeon I've ever worked with. But if you want a second opinion, Shigeta's very good.
And Tyler?
Sure. Paula, give this young man a rub down.
Okay.
I'll see you later.
Thank you.
Scared.
You have to memorize everything?
You know, medical history, present diagnosis, prognosis and treatment, blood group, serum group, diet, allergies, consulting physicians.
Only that much.
Oh, A.J. Kramer. Dr. Stepney's patient. Oh, negative. Severe anaphylactic allergy to penicillin.
That's me. You know, it's interesting. Dr. Tyler doesn't seem to have as many patients.
Yeah, well, his practice has fallen off ever since Dr. Stepney came on staff. Oh, attention, here comes Dr. Stepney.
Hey, Jay.
You.
I've got your x-rays. I'll see you in your room in 5 minutes.
Yes, sir.
Well, there's no indication of interdiscal narrowing, no arthritic spurring, no nerve impairment. I think what we're dealing with here, AJ, is a lumbar strain. We'll treat it symptomatically. Rest, some stretching exercises, hot packs. I'll see you later. I gotta get to surgery.
Excuse me.
Dr. Tyler looks on medicine as an avocation.
I understand his practice has suffered since your arrival.
His practice has suffered because of his own indifference to it.
He's a good surgeon.
He's competent. At least he was before he became a
Sorry, I got the wrong room. Excuse me.
It's okay. It's not my doctor. Oh, it's all right. Cut off the wrong leg. Excuse me.
Excuse me, Nurse Aarons? Mr. Kramer in 314 didn't check out today, did he? No. It's funny. It's not in his room.
The other room. She's downstairs now.
In your office? What did he take?
The IRS files are missing.
So, they know your financial situation's shaky.
When they see Richard's name in the files, they'll figure it all out. Now, I have warned you, Pender. I'll do what I have to survive. You are on your own.
Rick, it's 11:40. I'm on my way home. I've got what we need. That's it. I'll see you later.
Where have you been?
Me? I'm just out stretching my legs.
We've been looking everywhere for you.
I'm sorry, I didn't know. I'm gonna check out.
Did Dr. Stepney release you?
No, but I'm feeling a lot better.
Then you have to sign a release. But if you'll wait right here, I'll get the form for you and you'll be out of here in no time.
Okay. Thank you. I don't know what's taking them so long, but I've... What is that?
Allergic to penicillin. What room is my spinal cyst in?
Mr. Captain? 312.
I think we're going to have to perform an emergency operation on Mr. Kaplan. Please get the patient prepared. I believe he's in room 314. I will also want an IV with penicillin for the OR.
You're going to give Mr. Kramer penicillin?
Kaplan, the patient's name is Kaplan.
I didn't know something like this was going to happen.
Neither did I, but it has, and we have to do what we have to do.
If I can go through with it.
It isn't a question of money anymore, Helen. It's your whole life on the line.
You've reached Simon & Simon Investigations. At the beep, please leave your name and number and any message that you wish. Thank you. Rick, look, before I leave, I've got to sign some forms. I don't know what...
Go. Good. Let's get the ID going.
I'd like the penicillin started stat. Understand?
Yes, Doctor.
He wanted to leave. I think he checked out.
You don't know my brother. He wouldn't leave without that.
Where's his chart?
It's not here. He's checked out.
Okay, where's Tyler?
In OR.
OR.
So, sir, I'm sorry. No, it's
Where is
not
the
in
OR?
Come
on, lady, where
Call security.
The intravenous penicillin is ready, Dr. Tyler.
Go ahead. Start giving it to him.
Start it, Doctor. It'll take a few minutes to get to him.
Let's speed things up, shall we? I'd like to cut as soon as possible. Mr. Kaplan has an infected cyst that is putting excessive pressure on his spinal cord. It shouldn't wait. I'll make the incision now.
I'm sure in your line of work, you know what happens to a fellow when his neck snaps. My brother better be okay. He's okay. He's okay, I found he's okay. Let's go check on him. Something happens inside of a man like Lloyd Tyler.
Nothing a surgeon can help, Kyle.
Not even the new chief of surgery.
Yeah, congratulations. It's okay, I guess San Quentin will welcome Dr. Tyler and his medical skills. Whatever's left of him.
I want to thank you for all you've done. I'm very grateful. Excuse me.
You know, Doc, it wouldn't hurt for you to stop and smell the flowers every once in a while.
Remember, it's good to be alive.
What flowers?